Okay, got it. Introduction of our new staff now. Okay, great. Well, I want to say that I was very pleased to be part of the interview team with Likia and Jessica of our two new staff members, our organizers in housing and somewhat in healthcare. We are combining to a certain extent those two programs under the direction of Likia. Our new staff are Anaxel Rama and Isel Romero. They're here with us today. In fact, Anaxel is one of our co-facilitators. He comes to us as an organizer for close to 10 years with the Community Housing Partnership, which is now called Home Rise in the Tenderloin. And he definitely, which we heard in the interview, sees the intersectionality of housing with healthcare. He has worked in the Tenderloin, as I say, for close to 10 years. And housing and healthcare are so important in that community. So he comes with that background. And he's been an organizer for those many years. And he's very excited, as he said in the interview, to do outreach with for new members for SDA. And he brings a lot of experience and organizing skills and enthusiasm to the housing program. So we're really excited to have Anaxel joining us and being here today and being a co-facilitator right off. Now, Isel Romero, the young woman who comes to us from the Center for Independent Living in Berkeley, and where she collaborated with the disability community, doing grassroots advocacy and organizing for their concerns, which again, housing and healthcare were a big part of that. She told us that racial justice is very important to her. And she also sees the importance of people telling their stories and helping people to help others to step up to advocate for themselves, which is exactly what SDA is all about. So you can see why we chose these two people, and we're so happy that they said yes, they want to work with us here and be our new organizers. So thank you so much, Anaxel and Isel.
Thank you, Betty.
Yeah, you're welcome.
This is so great. Also wanted to, I don't know how many of you saw this, but we also have Amy Joseph, and she is our new administrative coordinator. And I'm not sure how many people was in the meeting before.
Lydia.
Yes.
Lydia, sorry to interrupt. I think you're still maybe in the main audio channel, not one of the English language channels. So we can't hear you in the English channel.
Oh, I'm sorry.
That's okay. Thanks.
And
You
so
might hear her on the English channel.
Oh,
Do you have mute original audio on, Jessica?
No, I do not.
Okay, then yeah, that might be why.
oh, okay. Sorry. Can you hear me now?
Yes, I hear you now. Thank you.
Okay, thanks.
Just want to make sure.
So we're very lucky to have 3 new staff members, but I'm seeing more in here, and it's really exciting. I see that we have Lucy Patricio. I never seen you here before. Are you new? And also, I saw someone else here.
Matagal na si Lucy, kaya lang minsan-minsan lang nag-attend yan.
Person with a name with an O.
But she's okay, yeah. I'm glad maraming Filipino ngayon.
But this
That's
is really
Orlon.
exciting to have
That's
so many people.
my best friend from
Orlon,
college years.
you new to
Yeah,
us, to
yeah,
SDA?
yeah.
Hi, welcome everybody. And so, Sioni also,
Si
right?
Shoni, bago yan, si
I'm not
Shoni.
sure if I'm missing someone else.
Yeah.
Um,
Thank you for coming, Shoni.
if you wanted to say hi, if, if you're new to this space, let us know. Thank you. So we can start now. Oh my goodness. So our first order, Jessica is gonna be talking about, we're gonna remember Judy Human. Is that how you say the name? Jessica?
Yes, Judy Human. Before we do that, just saw the request for the agenda. Sorry that we hadn't put that in. So I just shared the English agenda, and there's the Spanish. And yeah, so I'm going to talk a little bit about Judy Human, and then we'll have members talking about the 3 advocacy agenda campaigns, and as always, announcements at the end. All right, so actually give me one moment to turn off my heater, which is very loud in the background. Okay, sorry about that. Hi, everybody. I'm Jessica. I hope you're doing well today. So Judy Human was this incredible leader in the disability rights movement for the last 50 some odd years. And she died on Saturday, and we really wanted to take a few minutes to remember her. So who here knows about the 504 sit-in? Put your Zoom hand up or a thumbs up if you do. All right, I see a bunch going up. So the 504 sit-in was in 1977, the year I was born. It's easy to remember for me. And it was at the old federal building in San Francisco, which is right at UN Plaza. And it was because there was a Rehabilitation Act passed federally in 1973. And there was a little piece that some really great advocates snuck in the law that was called Section 504. And Section 504 said that any program receiving federal funding had to be fully accessible to people with disabilities. And that meant not just physical access, like ramps or elevators, but it also meant things like you have to allow people with disabilities to participate, can't exclude them. You have to have American Sign Language, ASL, or Braille or large print, all of the different kinds of things that can make a program accessible. So this was huge, but the federal government needed to sign regulations to actually make it happen. And 4 years later, 1977, they still hadn't done that. So disability advocates across the country did protests at federal buildings, and they were in a bunch of cities. San Francisco was the longest. It lasted 26 days. Oh, good, my heater stopped finally. Okay, so it lasted 26 days, and they had disability advocates who occupied the building. They went in, they refused to leave. They used the sinks and the regular bathrooms for showers and to take care of themselves. The Black Panther Party had their breakfast program at the time. This was in the 70s. And so they brought food to the protesters. Glide Memorial Church and other groups in San Francisco brought blankets and supplies. There were personal care attendants and ASL interpreters who were helping out. It was this beautiful, strong effort with a lot of solidarity involved. And Judy Human was about 20 at the time, and she was one of the leaders of that protest. And people are putting great stuff in the chat. Thank you. I see Carol put the Power of 504 documentary. And if that's the Carol, I think it is. Is that the Carol from Sacramento? I feel like I should give Carol a moment to say something. I don't know that I've seen you here before, but I wonder if you knew Judy. Did you know Judy, and do you want to say something? Okay, now I can't see you, so maybe not. All right. So if there's anyone here who was part of 504 or who knew Judy and I'm missing that, please go ahead and put your hand up and we'll make sure to have you say something. So I was, and then also in the chat, folks mentioned that Judy was featured in Crip Camp, a fabulous movie on Netflix that came out a couple years ago. And it's about a summer camp for kids with disabilities in New York. It's a lot of fun. So definitely watch that if you have Netflix, or let us know if you want another SDA showing. We did that once and that was fun. So I got lucky enough to meet Judy once, but it was really intimidating because I grew up disabled. I'm in a wheelchair for those who don't know. And as I started learning about disability community when I was a teenager and in my 20s, I learned of Judy. She was often called the mother of the disability rights movement. And I was visiting Washington, D.C. at one point, and my power wheelchair wouldn't charge. And I thought the problem was my wheelchair charger was broken. And I didn't know what to do because I was away from home and I had to be able to get home safely. So I texted a friend of mine, Corbett O'Toole, who was also part of the 504 sit-in. And she said, call Judy Human, you can borrow a charger from her. And I was like, you want me to just call Judy Human and ask her for a charger, right? Like, I can't do that. She was like, no, it's fine. And so I called Judy. She gave me her cell phone. I called her up, and I remember this really awkward conversation where I said, hi, my name is Jessica Lehman, and I have been a fan of yours. You know, you're one of my heroes. And I wonder if I can borrow a wheelchair charger. And Judy was, you know, part of what made her amazing was that she did this incredible activism and was a leader at all levels and was really recognized nationally and internationally. But she was so down to earth, and she mentored and supported so many other disabled people, and particularly young people. And I think particularly young disabled women. And so she invited me to her house, and this was pre-pandemic, of course. And she loaned me a charger, and we chatted for a little while, and she was wonderful. So I just had to share that little story. I'm sure I'm running out of time, but I want to share 2 clips. Why can I not get this to open? One moment. Okay, so I'm going to show a clip that aired on NPR, not NPR, PBS on the NewsHour, and they had done an interview with Judy a few years earlier, and so I want to share that. Okay, and my sound is being a little funky. So somebody tell me.
Who has been called the mother of the disability rights movement, has died at the age of 75. President Biden, in a statement noting her
Can somebody
passing,
unmute and tell me if you can hear?
Trailblazer, a rolling warrior
I
for
can.
disability rights in America. Human, who lost her ability to walk at age 2 after contracting polio, lobbied for legislation that led to the passage of the landmark Americans with Disabilities Act. Tonight, we hear her in her own words as we revisit her brief but spectacular take on the disability rights movement.
When I was 5 years old in Brooklyn, New York, on East 38th Street, my mother did what every other parent did when their kid was 5. She took me to school to register me. And this was in the early 1950s. There were no motorized wheelchairs, so she pushed me to school, and it wasn't accessible. She pulled me up the steps, and the principal said I couldn't go to school because I was a fire hazard. I don't really know that there was an explanation. It just was. I think the average person, they see disability as a threat to not being able to do things as people have typically done them. And I think there's truth in that. But the question is it because one has a disability, or because society itself has constructed itself in such a way because they haven't seen us? Discrimination against disabled people has existed from the beginning of time. And we're in a place right now where, because of other movements, civil rights movement, the women's movement, the Black Lives Matter movement, etc., people are speaking up and out. One of the first pieces of legislation that the disability community really engaged in was getting regulations developed for a provision of law called Section 504. Section 504 says you can't discriminate against someone who has a disability if the entity is receiving money from the federal government. It was the first time that many of these young disabled people felt a part of something and really felt that they were making a difference, not only for their lives, but for the lives of many others. There is a shift, I believe, going on in our society where we're looking at race and gender equality and disability as issues that we need to address, that diversity is something that makes our companies stronger, that diverse businesses provide better services for customers. I also am a very big believer that the disability rights community cannot stand on its own. We need to be working with all other movements, and we want all other movements to be inclusive of disabled people. If we are actively learning and working together, we can do things like make sure when housing is being built in our communities that it's accessible, not just for people who have physical disabilities today, but if you're going to have a physical disability tomorrow. I think having a disability really has allowed me to do and get in touch with so many things and opportunities that otherwise would not have happened. People look at us as the label of our disability. And it is a part of who we are, but it is not who we are. My name is Judy Human, and this is my brief but spectacular take on the disability rights movement.
All right. So that's Judy Human. Thank you, everybody. Oh, I meant to say, there was an audio description in that video, and I didn't want to interrupt Judy speaking, but they were showing photos of her throughout her life, pictures of her as a kid in a very old manual wheelchair with braces on her legs. They showed her at I think there was a shot from Crip Camp where she was at the camp. They showed her when she was fighting for 504 in San Francisco. And then, of course, some more recent ones. And then they also showed when they were talking about solidarity with other movements, they had some photos in there of women's rights protests and Black Lives Matter protests and other things. So there you go. Thanks, everybody.
Thank you,
Thank you so
Jessica.
much, Jessica.
This was great.
Leah, I wanted
So,
to ask if we could go back to the community
We're gonna
guidelines.
present our advocacy agenda. So we have,
Leah, sorry, 1 second. Anoxel is speaking in the interpretation channel. He hasn't joined. Anoxel,
an Axel?
Anoxel, can you make sure you select English as an audio channel? Because you and Leah were talking at the same time for a second. Thanks.
Sorry about that.
Okay, go ahead,
still
Leah.
trying to figure out the online. I wanted to rewind us just a little bit.
You're muted.
I'm on mute.
What's going
I
on?
wanted to go back and see if we can circle back to the
Oh,
community guidelines.
Anoxel, sorry to interrupt. You need to join an
I'm not
interpretation
sure,
channel.
what am I supposed to do right now? An Axel is okay, no?
Leah,
don't
1
hear.
second.
Okay.
Anoxel, can you join the interpretation channel? You got to go to the bottom and just select the interpretation in the globe icon. Or if you're on your phone, then join, hit the 3 dots. Because what's happening right now is you and Leah are talking at the same time.
Work better if I talk from my computer. I apologize, everybody.
That seems to be working. It seems like that one has joined the English language channel. You hear him, Leah?
I don't know if people will be able to see me because my laptop is difficult. I apologize. I
Go,
just
go, go.
want
That's
to
good.
ask if we could rewind a little bit and go back over the community guidelines before we get into introducing our advocacy agenda. And if that's okay, I'm going to go ahead and go into that. So the community guidelines that we have, and you know, I'm very new here, so I'm assuming that these have been worked on throughout the years here at Senior and Disability Action. And I've read through them, they're really great. So I'm just gonna roll through these real quickly. And if one of my more computer savvy colleagues could share their screen, I might be able to share my screen. Let me see. If I can share this screen. If everybody can see this, here are our community guidelines. I'm hoping people can see this. And they are: no bigotry, hate, or slander will be tolerated. Assume positive intent. All truth is truth. Take space, make space. Vegas rule, which means what we're talking about here is going to stay here. We want to be able to have a safe space for people. Each one, reach one, teach one. Ask permission to inquire after a share. Practice self and community care. One mic, one voice. Correct with care. Don't assume knowledge. If you use academic jargon, explain the terms. Appreciate cultures through community. And I will stop sharing. And I think those are really, really beautiful. I really think that they center all of us to be able to have a great productive meeting. And if we can all agree to them by putting a thumbs up or clapping your hands, or I think that'd be really great, so we're all on the same page. Great. Well, I am really excited to join Senior and Disability Action. I apologize that I'm not on camera. My tech didn't work out today. And I'm really excited to kick off this conversation about our advocacy agenda. One of the things that really drew me to Senior and Disability Action was how bold folks are here in pushing for change, and that we don't do it without the membership. And so when we're talking about this advocacy agenda, I really hope that you can find ways that you're able to plug in to help support us to move this forward, because we are stronger together, and united we will never be defeated. So I really hope that you can find your voice in this advocacy agenda. We have everything from pushing for more access and more affordable options for public transit, to bringing in-home health supports or health support care for people that are currently unhoused, to pushing to make sure that our mask requirements and that we're continuing to center people's safety and health well-being in the community first, and prioritizing our community. So I'm really excited to hear more pieces of the advocacy agenda, and definitely want to invite everybody to the Housing Collaborative meeting that we'll be following up with y'all on as well.
Thank you, Naxel. And today we're gonna start. Jessica, you want us to say something? I saw your hand up.
I just wanted to clarify, Alice made a point that we actually should revise what we put out there in the group agreements, because general meetings are public and we share them publicly on YouTube and our website. So folks should know this is not a confidential space. This is intended to be public unless we do small groups at some meetings. So just want to clarify.
Okay,
Thank
thanks.
you. My bad, y'all.
No, it's all good. So to start talking about in deep about our advocacy agenda, we have here one of our members, Alan Cooper, and we're gonna start with this part because he has a doctor's appointment. So let's start with Alan. Alan, are you ready?
You're on mute, Alan.
Alan? Did we lose Alan somewhere?
Oh,
Uh,
Where'd you go?
are you there? Oh,
Looks like
we
Alan just had to
lost him,
rejoin. Yeah. Mhm.
yeah. Sorry. Well, Alan gets ready. Alan, oh, go ahead,
All right,
Alan.
I got it. Can you hear me? Yes? I
Yes.
unmuted. Okay. Hi.
Oh, Alan, we can't hear you yet. Just so you know, it's weird. It says you're unmuted though, so that's good.
I don't see.
Oh, you have to, I know, you have to rejoin the audio channel. Alan, sorry, you have to rejoin the English language audio channel since you rejoined the Zoom. Thank you.
Unmuted.
Right. So you'll just have to rejoin the English language audio channel now that you're back
Oh, I
on.
see.
Yeah, thank you.
So
Okay,
it looks like Alan is
um,
having a difficulty right now.
He is
Alan?
just rejoining the English
Interpretation
language audio channel because
English.
he had to leave the Zoom.
Okay, can
and so
you
now he's rejoining, but he's also having some
Okay.
choppy connection. So let's see how it goes.
hear me
Okay.
now?
Thanks.
Yeah.
Hello?
Yeah.
Oh,
here
go
we go.
ahead, Alan.
I thought I did. Let's see. Got it?
Yes.
Yes, go ahead.
Oh,
please.
thank goodness. Okay, so okay, a little bit of, okay, so we had a retreat and everybody, we had a great facilitator. We went through things that possible, a lot of important things that we might do. And in the housing and healthcare area, there were a number of really great suggestions, and I hope we won't forget about them. Things like improved building codes for people with disabilities. But I advocated for one particular thing. Allegra Fortnati and I are members of the DOS board, the Department of Disability Aging Services. And early on, we asked, what kind of services do you give to homeless people? DOS does a lot of wonderful things. Many people here probably use some of them, including in-home support services, computer services, food, Meals on Wheels, et cetera, et cetera. And they said, we don't give anything to homeless people. That's the job of HSH. Homeless and supportive housing. And Anoxel knows as well. And HSH really doesn't provide many services for the homeless. They focus on housing, which is very important, get them housed, and then other things will come. But there are about 7,000 to 10,000 people living on the street, of whom 15%, or around 1,500, are seniors, or at least they were in 2019, and I don't think it's gone down much. Another important fact about unhoused seniors is that 45% are more than 50% are African American. Now that's a real equity issue, since only 5 or 6% of the city is. And so we began to work on a proposal to provide services for unhoused seniors. And we presented it to both departments, and they said, gee, that's really important. HSH said we don't have the bandwidth. DOS said it's not our problem. But then they are beginning to work together. But we have formulated a number of things that could be done in shelters to help seniors. If you're in your 60s or 70s and you're living in a shelter, you often have medical issues. You need to get to the doctor. You have to take maybe 2 or 3 buses. You need to get to the pharmacy. You need to keep track of your medicines. One of the hardest things for people who are unhoused to do is to keep track of their medicines. While there may be a nurse in the shelter, they can't take care of everybody. So keeping track with your medicines is very hard. You may have mobility issues. I used to work in shelters a little, many people in wheelchairs or with walkers or with canes who just can't get around very well, which makes getting things, showering, Then we have people with diabetes and hypertension who need special diets. So what could we do? So when this was proposed to the group, eventually, after many iterations of discussions, it came up as a high priority for SDA. And I've been a member of SDA for some years and worked on a number of our issues, and we've had some success, like the wheelchair campaign. And so they want to take this up. And that's great, because we're very excited about doing that. And we're still sort of formulating exactly what to ask for to begin to get services into shelters and maybe even on the street, and what specific services would be useful and how to configure them. But I hope over the next month or two, we'll have a really firm proposal to take to the supervisors, to ask the supervisors to demand that the two departments work together to implement our proposal. And the two departments understand that there's pressure coming. So we're going to have a speaker from HSH at the healthcare meeting next week, I guess. And I hope everybody will come to that meeting to hear what they have to say. But they often talk about the things they're doing in SROs and in other supportive housing. And we need to pin them down, and we need to get the supervisors on board to demand this, and we need to get the mayor on board to demand it. And we can help the most vulnerable seniors in our city, those who have nowhere to live, those who have to live on the street or live in a shelter, and help them have a more decent life. That's my pitch. Thank you.
Thank you, Alan. So we're going backwards because Alan needs to, step out of the meeting. Sorry about that.
I gotta go to that. I have to go.
Thank you, Alan, for making the time for this. So let me talk to you a little bit about what the backstory on the advocacy agenda. What is it and where did it come from? So each year, following the January straw poll of the full membership, staff, board members, and member representatives from each program, we each program from Senior and Disability Action, we determine, we go into a retreat and work on determining 1 to 3 advocacy priorities for the year. That doesn't mean that we don't do other things. This means that these are priorities that SDA is leading in some ways. The other campaigns we still working, are always there, like Medicare, things around Medicare. We work on issues that are affecting Medicare, but we don't take the lead on that because this is a coalition work. And we take the lead sometimes of CARA or sometimes of other bigger organizations that are working on Medicare issues. So that's so for this year, we had the primary concerns of our community. You remember when we met in December, you came out with wish list, of what we wanted to have in our work at SDA. So from all those stuff that you wrote down, Jessica put them on a piled them by categories, and then in January, the people that were present on that meeting, either in person or by Zoom, voted on these issues. And out of that, we came with the ones that got more votes. And our group, board members of the different working groups at SDA and the staff, we we revised this on whether these campaigns were uplifting all of our values, and also were part of, something that only SDA can do. And so out of the many things that you express your interest on working on, we end up deciding on this 3 advocacy campaigns, advocacy issues, I should say, right? And so as an actual mention, we have the require mask in public spaces, including healthcare facilities, schools, transit, and government buildings. And the one that Ellen was talking about on, ensure access to home care for people who are unhoused or marginalized house. And the last one, which is not going to be right now the priority of all of the organization, but it will become more relevant in the second half of the year, is the bring back transit services and add bus shelters with seating. And this is one that is gonna take off once we get our new transit organizer, transit justice organizer. As you know, I retire, and so we are in the process of hiring a new transit organizer. And so please, if you know about people that would be good in this role, send them our way. And so we're gonna continue talking about this advocacy campaign, but right now we're gonna have a break. Is there anything else that I should say before we go on a break? No? Okay.
Yeah, how long is the break? When should we come back?
Yeah. I should say that, right? How long is the break? Let me see.
Amy is reminding us in the chat that it is 10 minutes.
10
minutes.
Thanks, Amy.
So we'll see you all at 11:10.
All right, thank you. Thank you. See you guys.
Thanks, everyone. Alyssa, if you're there, can you say something quickly? We'll just do a quick test before the next section.
Hi, can you hear me?
Yeah, and then let me test one thing. Oops, click the wrong thing. I do hear you, which is a good sign. Okay, now say thing in 2 seconds. Say one more thing.
Hello, everybody. I hope you can all hear me.
Yes, excellent. Okay, great. Thanks, Alyssa. We'll be good. So yeah, we'll see you after the break. Thanks.
Peter, do you want to check Beth and David too?
Yeah, I'll check Beth and David too. Good idea.
Unless they're on break.
Yeah. Beth, if you're there,
I'm
say
here.
something. All right, great. And have you already selected interpretation?
No, how do I do that?
Oh, yep, I see what's happening. Okay, so yep, I see what's happening. So what you'll need to do is go down to the bottom and select an interpretation channel. And just select English. That way you won't accidentally talk over anyone else who's in the other channel. Do you are you familiar with how to choose the audio channels?
I think I did it. I'm on an iPad, so it's a little different, but
Great. Let me go check the channel and see if I still hear you. All right, go ahead, Beth. Can I hear you?
sure. How does that work?
Oh no.
Oh, no.
No, so I think I think what it is maybe you have to go all the way through and then click done, because on an iPad, did you do that when you did it?
It just says interpretations and I selected English and let's see, done. How about now?
Okay, 1 second. Let me just check. All right. Do I hear you now?
How about, yeah, let's see if it's working.
Yeah. Okay, great. Yeah, that's perfect. Thanks, Beth.
Thank you very much, Peter.
No problem. No problem. And then I see your hand, Betty. Can you hear me?
Yeah. The only thing, I know we're on break, but I wanted to be sure when we come back that we continue on the home care and services, because I know Alan gave his presentation, but we still have what we're doing now. And then the educational forum on community living that Jessica, just to be sure, because according to the agenda, we'd be moving on to masking right after the break, but we didn't quite finish the home care and services section of the agenda prior to the break. So I didn't want to miss that next part.
For sure. Good check.
Yeah,
and we can
that's all.
have a quick check-in with Leah and Jessica, because I know they're monitoring the time, so maybe they were choosing to hold that till the end, but yes, good point, Betty.
Peter, this is
and then
David.
David, 1 second, I have to check in with
Okay.
David, and
All
then
right.
we'll come back to you.
All right.
David, hello. How are you? Other than the accidental trip to the church, I'm sorry about that.
Wasn't accidental. I'm
well,
here.
yes, no, that's true. Okay, great. Glad you're here. So for interpretation channel, I hear you. Let me, and my original audio is muted, so you're good. Great. Thank you, David. You'll be good to go when the time
Not
comes.
my first rodeo.
I love to hear it. David.
Yeah, I know time is of the essence, but I would
You're
appreciate
good. We're on break.
it.
Yeah. Mhm.
We've been talking a lot about San Francisco, and that's great, but
Mhm.
nothing has been said about the East Bay. And I would like to know how this advocacy agenda is going to be presented in the East Bay and how we're going to deal with all of these issues. And nothing has been said, so that would
David,
really be
I have-
helpful.
Yeah,
David,
I was
I
gonna
have
say, I
two
think you have
quick-
good news.
I have two quick responses. One is
Okay.
the very next issue, Beth and Alyssa will talk about San Francisco and East Bay.
Right, I know. That's the masking. I know.
And I think David will as well. And I know you weren't able to come to the last couple East Bay
Yeah.
meetings. We've been talking all about this. So if you
Right.
come to the next one, we'll definitely revisit that and we'll be able to talk more.
Yes, but I think
Thanks,
that
David.
in a general meeting like this, I think the East Bay should be included, Jessica. Thank you.
It is definitely
right.
included. Stay
All
tuned.
right. And now my speaker is working today, so we'll see what happens. Okay, thank you.
Great. Thanks, David, for checking in on that. And thank you, Jessica. Jessica, did you hear Betty's question earlier? Are we going to go back when we come back from the break to just tie up the little end bits on the home care and services, or did you want to hold that till the end? Did you and Lehia want to hold that?
I'm sorry, I missed the question. I was talking to Lehia. What was it?
Oh, sorry. Not literally just now. Betty was just wondering.
Masking campaign. Elisa?
Hi, everybody. Masks for Equity is the SDA group that I work with. They're a passionate, active group led by the fearless Rhea Small. We testify constantly at health department meetings, both local and statewide. We testify constantly at transit agency meetings on both sides of the bay. We recently held direct actions in person at San Francisco City Hall and also at Oakland City Hall. This issue is important because of its focus on anti-racist policy that protects BIPOC communities, seniors, and disabled people from the still very prevalent COVID virus. We had a victory this week when the San Francisco Board of Supervisors voted 10-1 to extend remote access to San Francisco government meetings, allowing seniors, disabled parents, communities in the southeast part of San Francisco to participate in democracy. We met this week with the California Department of Public Health, urge them to continue masking in healthcare settings. We'll be talking more about that. I say basically that masking is an individual decision or choice, and that they are aligning with CDC guidelines. We think masking is a policy that keeps the senior and disability communities alive and thriving. Thank you.
Thank you, Lisa. This is great. So for those of you that wanted to,
I'm sorry,
ahead.
I think I'm supposed to speak next. I'm not sure if I was supposed to jump in there or not.
Okay, okay, Beth. Yes, you're right.
But I just wanted to follow up with what Alyssa was talking about, because what we're dealing with is right now, people are saying COVID is over when there are 400 people a day dying in the United States. And the vast majority of those people are seniors and people with disabilities. And further, there are thousands of people a day who are being infected who will go on to develop post-COVID conditions of long COVID, of major organ damage, of heart attacks, strokes, aneurysms, type 1 diabetes in kids is skyrocketing. And our public health leaders are saying, we don't need to deal with this. We can remove things that we know prevent transmissions. And there's a disconnect from what's happening in the scientific community and what's happening in the public health guidance. And our community, seniors and people with disabilities, are in the crosshairs of that disagreement. And we are the ones who are being left to die and become more disabled by public health policies that are promoting the transmission of COVID at this point. And so this is very much a issue for our members. This is very much a racial justice issue. You can look at that when you see the decrease in life expectancy by race. Hispanic people have lost 4.2 years. Black people have lost 4 years. Indigenous folks have lost 6.6 years in life expectancy, while white people have only lost 2.4 years. The disproportionate impacts of this pandemic are staggering and will only continue to get worse as we move towards privatization of testing, treatments, and vaccines. And that's all happening in the next couple of months with the end of the public health emergency on May 11th. And here in California on April 3rd, we are undoing mask requirements in all high-risk settings, which include healthcare facilities, all healthcare facilities, which include prisons and jails, which include long-term care facilities, and people, the state of California has said, we are going to remove the requirements from these facilities, not because we find that masks don't work. They have never said that. They actually still continue to strongly encourage people to mask because they know the science proves that masking is an effective way of preventing transmissions. They're doing this not because they have not been able to point to any sort of scientific, medical, or ethical reason why these changes need to be made. And it's quite alarming, and it feels like a violent attack on our community, quite frankly. And so it's not getting better. It's getting worse. And I think we need to not only continue to fight with and push our state and county public health officials and not let them be promoting the comfortable lies that they are, that masking doesn't need to be required, that transmissions are okay, that long COVID and post-COVID conditions are not something that we need to worry about. These are all falsehoods that our community will pay for disproportionately. So we're fighting this at the state level with the county, with the Department of Public Health. We're fighting this at the county levels with San Francisco Department of Public Health and and Alameda County Department of Public Health. We're meeting with all these any officials that we can. We're supposed to be meeting with Jessica cornered Dr. Phillips into agreeing to meet with us, the San Francisco Public Health Officer. We are working with in coalition with Marked by COVID, another COVID organization, and we are building some national coalitions with other groups that are doing the same, like Mass Mandate New York. And some folks yesterday attended organizing a meeting that I haven't heard about yet, but I'm excited to learn about with folks from Washington State and Oregon for a tri-state coalition there. And we also need to let people know that they're being misinformed and how they can protect themselves. I think that's what I want to say. Thank you.
Thank you, Lisa and Beth. So I bet, go ahead.
I'll just add that the Tri-State Coalition that met last night is talking about doing direct action in the next couple of weeks, possibly in front of different health departments, including LA, which isn't part of a tri-state, but LA was represented, and we're just moving to coordinate some of those so that it can be that we can get press, that we can get people to join us, and there'll be more information on that soon. Thank you.
Oh, and we're also coordinating with the California Nurses Union and Dr. Noha Abaleta of the Roots Community Clinic in Oakland.
Thank you both. This is great. And, for those of you that wanted to participate in this campaign, so please, reach out to Rhea, or I think you can even, reach out maybe to Elisa or Beth, so feel free to, get in contact with them right now. For instance, you can do it right now, you can put your email right there in the chat, or you can say something, because guess what? Campaigns do work. How did I know that? Because we just had a campaign and it was an amazing thing that happened, because, they were trying to cut public comment from happening. And so it was introduced, a remote public comment, I should say, from happening. And it was going to be like, they needed to put like 72 hours in advance for people with disabilities to call in and say, like, I'm a disabled person and I'm going to be participating in the meeting in a couple days. And so I just wanted to say that even Elisa was part of this, right, Elisa? And you came to the city hall, and you talk about being accessible for public comment, being accessible for people, not just for people with disabilities. And remote public comment should be available for everybody, and you should not single out people with disabilities, because that's putting an additional barrier to participation. So let's say, hey.
And I
Thank you.
appreciate you bringing up our successes, because we have had successes along the way, like, and had fun too. We had a action that we did right before the holidays where we sang carols in front of Oakland City Hall, and got the Oakland to reinstate mask requirements in all their buildings and offer free high quality masks to people in their buildings. So, and we've had BART bring back masks for times, and this county of Alameda. So every time we do that, we are reducing transmissions, and those are tremendous victories. So I thank you for pointing that out.
Yeah, so maybe everybody can unmute yourself and say, hey, oh, look at that. Thank you, Lisa. That's so
Yay.
cool.
Right.
Alyssa, that's really good.
Sí se puede. And it was a huge victory because, you know, we had 10-1. So we end up, you know, making those people that were like, no, we're not gonna, you know, we're not gonna vote yes on this. They end up, you know, going our way. So yes, that's great. And so to continue this success stories that we have, we're gonna bring now David Williams. Thank you, Elisa and Beth, for your presentation. You know, this was good, and I hope that we can get more people to get excited about these campaigns. And now we're gonna have David Williams talking about the transit. Go ahead, David. You're unmuted.
You're on mute.
Good morning, folks. It's good to be here. Good to see everyone. It is actually exciting to have 46 participants. There were 50 for a while, considering I went by the Unitarian Universalist Church to what I thought was going to be a live meeting, and discovered there was nobody there. So at any rate, I'm back, and I will try to give you a presentation that's hopefully not too disorganized about the transit campaign or transit justice. Basically, it's about having an effect on public transportation in the Bay Area, both the East Bay and the West Bay, in terms of access for seniors, people with disabilities, to get to and from buses, on and off buses, get between buses, which means talking about what the routes are, what kind of buses they're using, whether they're able to lift up and down to let wheelchair access or other things, whether they are going from outlying communities to all parts of the city. Many of the routes, of course, were discontinued during the pandemic, and certainly not all of them have been restored. Some of them have, thanks to the efforts of our campaign. Of course, we miss the fact that Pyra is no longer our fearless leader. Hopefully we'll get somebody who is even more fearsome to help lead us as we take on Muni, because they're a very difficult entity to get through to. They seem to be not always doing things in our interest as they spread bus stops farther and farther apart, as they tend to make fewer buses on some lines or not continue to get out to, well, they now have finally restored from the Tenderloin to the ocean, and done that on the south as well. So they are starting to get there, but they actually have plans to, we think, make things less accessible for us. And I'd like to also point out that our campaign interfaces with both pedestrian safety issues and with mask equity, because we're talking about public transportation. We're also talking about access for people who aren't able to use public transportation, who have to use paratransit or their cars to have accessibility to and from points. That became a very big issue around JFK Drive when there were kind of contradictory issues about access within the park and safety within the park, as opposed to access from outlying neighborhoods to the park and being able to get into the park. And we need to, of course, be monitoring on an ongoing situation how that develops in terms of our members. We are doing what's called a Gimme Shelter campaign. It's a campaign to update, restore, and increase the numbers of shelters. As you know, it's a very rainy season out here right now, and anybody who's using a public transportation is likely to wind up waiting for a bus in very inclement weather, which is not good for our health and well-being. So we need to try and ensure that there are an adequate number, actually, bus stops, shelters at every bus stop. We did do a rally the day that was Pi's retiring date out in front of General Hospital. That was very successful rally. I believe that there's video and available from our staff. We have met recently, and we will be meeting again on April 14th. I want to point out that I think our campaign will meet all the criteria of the advocacy agenda, in that we can talk about specific. We expect to be able to win on some of these things. We did just have another win in terms of another bus route was just restored on the J Church line just a couple days ago. Of course, it is a high priority, and we also had many wins when it comes to pedestrian safety and crossing times on intersections and at muni stops. It's a high priority issue for people with disability and seniors. I think that goes without saying. It's an opportunity for new members and collaborators. We have worked in coalition with everybody from, the Bicycle Coalition to the Muni, Muni has come to our meetings, Parks and Rec have come to our meetings to tell us about their programs and things and find out what our concerns are. We also have worked in coalition with the Muni Riders Coalition and others, and we hope to continue to do that. We hope to reach out to have more effect in terms of BART and in terms of East Bay transportation. It also gives us the opportunity to develop new leaders, especially since at this point we are, in effect, leaderless. It aligns with the mission and the strategic goals of SDA and will fuel existing program work. And it also is, of course, because we're talking about people from all communities in San Francisco having accessibility on many levels, and about seniors and people with disabilities. It is also a campaign that is anti-racist, anti-ableist, and anti-ageist. That is my disorganized presentation. If there are any questions, feel free to ask them. Thank you.
David, this is Jessica. Thank you so much for that. I'm just going to add on, as David mentioned, our next transit justice meeting is on Friday, April 14th at 1 o'clock. So we'll definitely be talking more then. I am kind of filling in, so it's going to be a shorter, less intense meeting until we have a new transit justice organizer. But if you're interested, please email me at jessica@sdaction.org. And then I will also put in the chat our job announcement for the transit justice organizer, and it's on SDA's website. So if you are interested or you know anyone who you think would be great, please send them our way. Thank you.
Let me also add one thing about where we are with the Gimme Shelter campaign, because we are planning on resuming it when there is staff to work with us, or for us to work with, is that, as I say, we did have a rally and a press conference a couple months ago. We did a survey about bus stops and shelters and where they are and where they're needed. That was well received, and that we believe SDA has a copy of, as well as we are going to reach out and try to talk about what kind of legislation or who we need to collaborate with within the city to see that our goals are achieved.
Thank you, David. Thank you, Jessica. And I want to say, I'm sorry, David, that that you end up going. Peter sent an email yesterday about the cancellation because, you know, they said that it was gonna be pouring really hard, and you know they expected floodings and blockage, and you know, and so we were trying to minimize the harm for our members. So but I'm glad that you were here on Zoom, although it's not the same because we don't get to hug.
Well,
But it's
the real problem is just between somehow SDA emails do not come to me. They get sent to me,
Yeah,
but I don't.
we got to figure that out,
That's
David.
an issue.
Let's you and me set up a
Possibly
call.
with Comcast. I do get them personally from staff. I just don't get them from SDA.
sorry, Sarah.
Well, thank you for those presentations. And as somebody who has, you know, worked on with the advocacy agenda for years and years, I still sometimes like have trouble describing it. So I think I finally understand it. And I just want to explain what I understand. So the advocacy agenda are what we come up with as our top priorities, and they go across our campaigns. But I know that folks other years have had the question, but what about this project that we're working on? But what about that campaign? We are still doing all the campaigns that you know and love. All the campaigns that you're working on in your program groups and issues will continue as long as you as members, you know, continue to work on them. These are the items that we, through our process that Ligia talked about, determined were our top priorities for the year. And not that other things aren't priorities at all. They're just if that makes sense to folks. Just wanted to chime that in because I think I've had a hard time myself coming up with like a succinct way of explaining it.
Yeah, well, we doing these three main issues that are mainly in the city of San Francisco. We're still doing work that is, you know, focus on a state policy like SSI. We continue to do that. We continue to do Medicare, you know, defending Medicare is a priority, you know, and so we continue to do that. But I see that Kathy has unmuted herself, so I think that she wants to say something.
No, I'm sorry if I muted myself. I've been
Oh, we
having,
cannot hear you.
you can't hear me? Let me.
Why I cannot hear her?
I think it's the same problem of the interpretation channel. So
Exactly.
everybody needs to go to the globe. And if you speak English, choose English. If you speak a different language, choose that. Otherwise, we will not hear you.
I've had a lot of trouble this morning.
Kathy, can you go on the bottom of your screen and choose English?
But Kathy, you said you don't actually have anything you want to say right now, right?
I'm sorry. What did you say, Peter?
There's nothing you actually
Go
want to
on
make an
your
announcement
screen
about right
and,
now,
and
right?
go to
No.
the
So,
globe
Okay,
and
good.
choose
I'm fine.
English. So we can, because we cannot hear you right now.
Yeah, I'll chat Kathy about that, Ligia, but she actually just said she doesn't have any announcements. She just was accidentally unmuted.
Oh, okay. Thanks.
Yep.
All right. Okay, so, and Axel, you wanna tell us about, so that's for our advocacy, in terms of our advocacy, we're done, but we have some announcements. And so we're gonna start with the staff to do this.
Yeah, I think we've actually divvied it up. So Sarah, if you want to kick off some of the announcements, actually, Sarah, Peter, go ahead.
Yeah, so I wanted to say, first of all, thank you everybody for coming today. And like Ligia just mentioned, we thought that there was that the deluge was going to start now, but I guess it's not now yet. That's okay. But it's great to see you all. And I just wanted to say that thank you everybody who did respond and say whether you're coming on Zoom or in person. And for future months, if you receive a phone call or an email, if you could respond to that and let us know whether you plan to come in person or on Zoom, or maybe just on Zoom if it's not a hybrid meeting, that will super duper help us with our planning for the meeting in terms of how much food to order, in terms of our preparations at the church, or also for all, if we're all online. And we have some opportunities for you all. If anyone would like to help us make these phone calls and make reminder calls after the first round of calls have been made, that would help us so much. So right now, we are going to allow you to if you could raise your hand, if you would be willing to help us out, make the reminder phone calls before the meetings next month or in future months. All right, I got Alyssa raising her hand. Anyone else available to help do some reminder calls next month? If you can do 10, you can do 100. We've got 350 people on our call list, so we could certainly use some support. Whatever amount of support you could help with, that would be great. If you can't decide right now, tell one of us later, but okay, Gozar is also available. That's okay. Tuesday or Wednesdays are great days to do these calls. As long as I've got you here, I will also remind everybody to guess what I'm going to say. Does anyone know what I'm going to say?
What?
I know.
Membership. Renew your membership. If you haven't already, please renew your membership or become a member today. I'm going to put it right here. Oh yeah, Hannah, you knew what I was going to say. Hannah is gives a monthly membership, and you can do that. You can give a smaller amount on a monthly basis, or on a quarterly basis, or so on and so forth. Go to the website and find out, or you can send us a check to our PO box. All right, I'm done. Sorry, that was too long.
Oh, thank you. Thank you. I think that we have now, something related to Wi-Fi. Isn't that exciting?
I think so. Hi, everyone. Hi, everyone. So a moment that we've been waiting for.
I cannot hear you, Peter.
After all that talk of me telling people to switch into the English language channel, I ended up there because I was checking on it. Sorry, everyone. Hi, everyone. The moment we have been waiting for in the campaign for some time and working towards is finally here. Supervisor Preston is holding a hearing on the digital equity resolution that we as a campaign crafted. Next Thursday, March 16th, so a week from today at 10 a.m., the Government Audit and Oversight Committee is holding a hearing on our resolution. The resolution is essentially the Board of Supervisors saying that they agree with our demands of these large internet service providers, that they should be doing more in the community, more to end digital redlining, where they intentionally do not invest in certain neighborhoods and buildings, doing more to expand affordable internet options so that it actually meets the need here in San Francisco and the Bay Area, where the federal poverty line is not an accurate indicator of the need. and investing in community programs and language access. This is really exciting. We've been working towards this Board of Supervisors vote for a long time. And it's an incredible opportunity for us to put a big spotlight on this issue, right? To use the stage of City Hall to make this issue a really key thing that the Board of Supervisors cares about and that these companies know they have to work on. Obviously, our actions have had an impact over the past 2 years of this campaign and getting the companies to expand internet access and invest in community programs. And this is another really exciting step as we think about this phase of the campaign. Remote public comment will be available. So if you can join us Thursday at 10 a.m. at City Hall, please be there. We're working to make sure that it is the first item on the agenda so that the hearing portion with our presentation and the testimony from the internet service companies, the Department of Technology, and the Mayor's Office on Housing and Community Development happens first on the agenda, and then that public comment on the item happens right after. Please be there. So if you can join us in person, please do that. If you can join us online or by phone, please do that too. We'll make sure to send out all the information to folks. Can people raise their hand if they're interested in doing either or, and we'll be following up with you to make sure. We're really glad that the remote public comment is still available this time around. Ooh, yeah, I'm gonna do gallery view so I can make sure that I see, because I see, oh, Elizabeth, awesome, and I saw Kathy, awesome, Kathy. And Beth is doing something with her screen, so I'm gonna say Beth is coming too. Alyssa, Beth's calling in. Orlin, awesome, awesome. Yes, great. Okay, I'm seeing a lot of folks who are down to join remotely. Denise, excellent. Okay, cool. Oh man, I should have been writing this down.
I got it.
You got it, thanks. I was like, hopefully someone else. And Maya, all right. And Lolita, excellent. Can we get 2 more? Maybe, let's see. I'm pushing my luck. Betty,
Yeah.
all right, 1 more.
I'm interested, just want the information
Rebecca.
on a little quick, but.
Absolutely. And I see you, Elmira. Excellent. Yay. Oh, this is a great crew. This is a really good crew. Folks, if you're able to come, if you're able to call in, it's going to be a powerful opportunity to state the importance of the issue. Hannah's going to try. Please also spread the word, right? The more, the merrier. We really want to make sure that people understand how important this issue is. Yeah, feels like a live auction. I always get into this mode. We'll be following up with folks to make sure that you all have some of the talking points that we're using and the research that we have collected on this issue, so that you have as much tools as you need to feel confident in making your public comment. Thanks, everyone. I'm going to pass the mic to, I think it's Stella Noxor, or is
me.
Jessica? Oh, it's Jessica.
I'm like, I'm gonna make it easy by just spotlighting myself.
Yeah, beautiful.
I am excited to announce a forum that we are doing on Monday. I'm gonna pull up the graphic. Okay, so oops, let's not have it be covered up. Okay, I think we're good now. So we all know that, well, not everyone may know, and that's okay, that Laguna Honda Hospital is the biggest nursing home, not only in San Francisco, but in the country. And it has been threatened with closure by the federal government for a bunch of reasons that we won't get into now. And so there's a lot of work to make sure it stays open, because there are a lot of people there. And it's an important part of the safety net in San Francisco. We also, as SDA, have been talking about how this is a really complicated issue. And while we are fighting to keep it open, we also need to continue the conversation about community living, right? That we want to make sure that people have opportunities to live in the community and get, like Alan was talking about, that people have access to home care and to housing and to services to be able to choose where they want to live. So we're doing this educational forum on Monday. It's called Rethinking Community Living, Expanding the Conversation on Long-Term Care Options. And I want to stress that it's really not an either or. Either we save it or we do community transitions, but we have to have both. So Monday, March 13th, 1 to 3 p.m. on Zoom. We have a number of really excellent speakers. Kelly Dearman, who's the head of the Department of Disability and Aging Services. We have Liz Grigsby and Sasha Bittner, who are both SDA members and disabled people who receive community supports. Michaela Connery from the Kelsey that does disability forward housing. Bill Hirsch from the AIDS Legal Referral Panel. And Roma Guy, who's a former SF Health Commissioner, and myself. So I realize I probably shared all those too fast for the interpreters. Sorry, but we will share all this information. And please register at bit.ly/rethinking with a capital R LTC, rethinking LTC with LTC capitalized. All right, and that's it.
So
Thank you,
Jessica,
Jessica.
did you say you're going to forward that information via email to everybody? Because I have a number of people I would like to tell about that, both from my SEIU 1021 Workers with Disabilities Caucus, both locally and
Wonderful.
nationally, and the
Yes.
retired employees of the city and county of San Francisco. Thank you.
Yes, we will do a follow-up from the general meeting and that will be in there.
Great.
Okay, so we have, is it you or an Axel that will talk about the housing collaborative?
It's me.
Oh, it's Elle. Hey.
So I'm going to talk a little bit about the Housing Collaborative meeting, which is happening on Wednesday, March 15th, so next week, from 1 to 3. It's going to be on Zoom, and that will be hosted by Anoxel and myself. And we're really excited to get the collaborative meeting going and meet everyone who's there. I'm really excited. And also introduce what our goals in housing are for this year. And of course, Anoxel has talked about how we want to make sure that we include these intersections of housing and healthcare, because those are two pieces that fit together. So, yeah.
Thank you, Excel. Next is the trip to Bakerfield that is being organized by Kara. So that trip is Friday, March 17. And we have to be at the library at 7 a.m., but you have to register. And so if you haven't registered, you might not find space at this point, but please, I urge you to try to register for that trip.
Can I chime in?
Yes,
Can
go
I
ahead.
chime in? First, I am the bus captain for that bus. So you will all see me there at 7 a.m. We will have snacks for everybody. There is a bathroom on the bus. It will be well ventilated. There is a mask requirement. There will be 2 seats or 2 spaces available for wheelchairs, I believe. It's a long trip, so dress warmly or bring layers. We don't know what it's going to be like in Bakersfield or, on the bus. I do want to say for all of you who have registered and are wondering that you didn't get a confirmation, you should get a confirmation within the next 24 to 36 hours. Everybody will get a confirmation with a letter about the trip and the site of the locations. We will be meeting, yes, at the main library in San Francisco at 7 a.m., where we will be, I think, on the side of the building where, over there, that lot behind the building that goes, basically it's Fulton Street. So it's at Fulton and Larkin. Likewise, the bus will continue and pick up people at the Ashby BART station in front of the Ed Roberts Center in Berkeley at 7:45 a.m. And then from there, we go nonstop to Bakersfield. Well, there may be a couple stops, just for rest areas if necessary. But that's the itinerary. As I say, you should get a confirmation shortly. If you haven't registered, go ahead and register, because we expect that there will be people who cancel at the last minute, even though our deadline is passed. So,
Could you share the link for the registration, David, if you haven't had it?
I can't do it. I don't have that
Okay.
electronic wherewith.
Okay. Let me
But
see if I
if
can.
somebody else can, that'd be great. Or else you can go to the CARA website, California Alliance for Retired Americans. With two.
I'll find it and share it. We can keep going. Thanks.
Okay.
Lydia,
Yes?
can you tell them why they're going to Bakersfield?
Yes. We're going to Bakersfield because we have another asshole as the, oops, sorry. I shouldn't say that, right? As the speaker now, and this guy is trying to really privatize or eliminate for once, all the different programs that we care about, which are Medicare, Social Security, and Medicaid. So these are very important programs for seniors, people with disabilities, and everybody in general, because you remember when they had that scandal and people that were doing their funds, retirement funds, lost it. A lot of those people end up needing to survive on Social Security. So Social Security is still a very, very important program. So this is what we are trying to defend. So this is a National Action Day, and California. There are buses from all over California coming to McCarthy's office, regional office. And so we're gonna show him our strengths too in numbers. So that's what I need to do, that we need to do. And David, do you want to add anything else?
Yeah, just, I mean, don't believe a word out of McCarthy's mouth, or for that matter, a number of the other people who he works with, or even the top of the administration in Washington, D.C., they claim to be wanting to save Social Security, say there are not going to be any cutbacks and things, yet they want to defund the administration of it, which happens outside of the fund itself. They also still want to set up committees that will look at either privatizing or raising the age. The real solution to Social Security is to raise the cap, make those people who make more than $600,000 a year pay more than what you and I do, because that's where it stands right now. And as far as Medicare and Medi-Cal, we know a little bit. Ligia has told us about ACO REACH and their programs within Medicare and Medicaid that will actually wind up privatizing it. We need to be fighting those tooth and nail as well. That's what we're going for.
Yep.
We are going in mass. There will be several hundred people on buses and another several hundred people coming from the area. It is going to be streamed nationally. If you can't go, you can actually attend it virtually. And considering all the press that's been in the papers lately, especially the Chronicle, about Social Security and Medicare and the big S.
Thank you, David.
The big S, we know that it's under attack, whether that they're lying. And when they tell you they want to save it, they want to deform it.
Yeah, thank you, David. That's true. And so we need to fight that. But we have other announcements. And so let me go to Axel.
Oh, sorry, my camera keeps going out. My
Don't apologize.
But I just wanted to save the date for people, just to put this in a bit of crumbs for you to come to our housing collaborative to hear more. But there is a evictions hearing about evictions and SROs coming up on March 20th that I'm hoping people could save the date for. As well as, and you'll be getting more information as we get the information, I'll be sending it out to you, but please save the date also for March 23rd is going to be a Council of Community Housing Organizations budget rally. And so we'll be forwarding more information. Please come to the Housing Collaborative to find out more. We'll see you next week.
Thank you. So let's see. We have done all of our announcements. So now you have like the public comment. 1 minute. Sorry for members. I wanted to make an announcement. I'm not gonna cut you, but you know, if you can keep it brief. So David, David, sorry.
Okay, I have a quick correction and an announcement. David, the bus will be picking people up at 7:45 in the East Bay on the west side of Adeline across the street from Ed Roberts, just to make that clear. The other thing is that I am going to soon make deliver a presentation to SFMTA on accessible wayfinding. We haven't decided exactly when, either March or April or May. And I want to say that I've already given this presentation to MTC's Policy Advisory Council, to AC Transit's Accessibility Advisory Committee, and to the San Francisco Senior and Disability Work Group. This is the first presentation that is actually providing specific principles of accessibility. I hope the trend will continue. And the idea is to get the agencies to understand that we need not to just talk about accessibility, but they need to understand that it has to be done in a systemic, integrated manner. And so I hope that you all will attend and also add your comments and questions. Thank you.
David, can you email that information to me, please?
Oh yeah, definitely. Thanks, David.
Thank you.
I've been
David.
talking to Matt West about it at SFMTA. Okay.
Thank you, David. Anyone else that wants to have, you know, something that is important to you that I wanted to share here?
This is Anoxel again. I just wanted to give a big shout out to Lehia, our facilitator for today.
Thanks, Lydia.
Oh my goodness. Thank you, guys. It's been really nice to see you all here, your faces and or your name, because some of you, you know, we cannot see your faces, but I hope that next meeting it can be in person and we can, you know, have also the hybrid option because COVID is still real, you know, and so we're going to continue to have that. So if anyone else wants to make an announcement, this is the time because otherwise you're going to miss it. No? Oh my gosh, we are on time.
Thanks, Lydia.
Thank you, everybody. It was
Bye.
sweet. Thank
Good to
you.
see everybody.
Bye.
Hope to see you soon.
Bye all.
Bye, everyone.
Bye.
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 Hola, Peter. Ahí está
Thanks,
Peter, no lo
everyone.
habíamos visto.
Thank you.